Hi, this is Kendall Hines, and I will be presenting. Okay, so for acute bronchitis, it's just an inflammation of the bronchial tubes. It comes about suddenly and it resolves around 3 to 10 days. It's diagnosed by listening to the lungs with a stethoscope. It's not typically life-threatening, except for elderly people or children or people with serious infections such as cancer or diabetes. It affects 4% of the population yearly. Pneumonitis is So with acute bronchitis, it's very common to have fatigue, which is just going to be impairing you during your daily life. You have mild fever, cough. So for pneumonitis, the most common symptom is shortness of breath. You also get that weight loss due to loss of appetite or Okay, so acute bronchitis is usually due to a virus getting into the respiratory system. It also can be due to bacteria. Some risk factors are living with a smoker, some occupational hazards, such as with coal miners, farm workers, or people who work around respiratory irritants, or living in an area with poor air quality. So it's really due to the air quality. Pneumonitis is due to So, in order to treat acute bronchitis, there's no pharmacological treatment to directly treat it unless it's caused by bacteria. You can use antibiotics to get down that inflammation. Really, what you want to do is treat the. So, for pneumonitis, really the thing to do is get rid of the irritant or allergen from the environment. You can also give them corticosteroids to get down that inflammation or immunosuppressants to, again, get rid of that. So when it comes to the top 20, both of these have to do with the obstructive lung disease section. For bronchitis, it's really an increase in resistance of the bronchioles, which causes a lack of air conduction, which decreases ventilation just due to that inflammation, which is So for this study, what they looked at was the effectiveness of pulmonary rehabilitation in patients with a lung disease of any etiology. And what they wanted to figure, and what they found was that it was effective regardless of the etiology. And what they also found was that So this study just looked at what the ICF classifications, a paring down of it is the ICF core set, which pertains specifically to obstructive pulmonary diseases. And so what this found was that 83% of the PT patients were successfully identified by this core set. What it points out